Bismillah. And boom, we're live.
All right, good.
So, welcome to Sharīah's Anatomy Podcast. I'm James.
Assalamu alaikum wa rahmatullah. I'm Chaplain Gareth Bryant.
Okay, and we're here to talk about bioethics from an Islamic perspective. This involves medical, healthcare questions, anything that requires ethical decisions. Doctors, like myself, don't always have the best answers from a secular standpoint, but thank God we have Islam to help guide us on making some of these difficult choices. So let's introduce ourselves once again. As you said,
I'm Chaplain Gareth Bryant.
okay, Gareth is a chaplain, and I'm James.
Dr. James Ferguson.
Dr. James Ferguson. I'm a certified doctor in family medicine. So, like always, we'll disclaimer out there that neither of us are Islamic scholars. Neither of us has any ijaza. We're not licensed to give formal rulings or opinions. So please don't take what we say as a formal fatwa.
We're just giving our expertise based on the abilities and the skills that Allah has allowed us to amass.
Exactly.
So you can just take it with a grain of salt.
Please consult your local scholar for any really dicey questions.
And or healthcare professionals as well.
And or healthcare professionals. That's correct. All right, so we're just going to talk about some interesting bioethics topics that are affecting us today and discuss them from an Islamic perspective. So I just want to talk about some follow-up questions from last time because there are a couple people who asked us questions.
Okay, good.
If you're a Muslim, can you refuse a transplant or a transfusion?
I'll be honest with you. Principally, as a Muslim, being Muslim first, I don't have a justification to say yay or nay. Mm-hmm. I'm going to say what I would do.
Right.
I would not refuse one.
Right.
That's just me personally.
Sure.
I would not refuse one. Sure. Just based on principle in terms of the maqsid from amongst the maqasid of the Sharīah, the objective amongst the objectives of Islamic law is the preservation of life as humanly necessary at all costs.
Yeah.
So if you have an opportunity that Allah has allotted you to preserve your life or to preserve the life of a loved one, Islamically, you're obligated to do so.
Sure. I think people are afraid of surgery. They're afraid of donations. They're always afraid of
Rightfully
risks.
so, definitely.
And it's normal to be It's normal to be afraid. No,
Yeah.
it's
Those are valid fears, Islamically. Yes, definitely.
Absolutely. But I'd still say try it anyway. I know it's a scary thing, but this is one of those tests that you're given.
Yeah.
Someone else had said before, we're such hypocrites. If a dog is in pain, let's put him down peacefully. But if a guy is dying painfully, wants to die, not allowed.
The reason why that's such a poor example is because animals don't have souls. Humans have souls. Mm-hmm. So by virtue of the fact that human beings have souls, we're obligated to treat human beings in a more humane manner. Mm-hmm. And we're obligated to be more selective in how we choose to care for a human being, specifically and exclusively pertaining to end-of-life care.
I see.
That's the reason why.
Sure.
Because if it's a non-human, the regulations, the ahkam, the rulings for dealing with a non-human is significantly different than dealing with a human. Because the human being, by nature, by virtue of them being a human, they have more rights naturally than an animal.
I see.
So, and by virtue of the fact that a human being has more rights given to them by Allah than an animal, we're obligated to treat a human being better than an animal.
I see.
So it's not just like, we're just going to put them out there in misery. No, we have an obligation Islamically to seek out all options to see if we can, number one, improve the quality of that person's life.
Yeah.
Or, worst case scenario, end their life in a dignified manner. But it's not just, if it's a problem, we just put them to sleep. No. Yeah. They're not animals. They're human beings. We have an obligation to treat human beings as Allah created them, as human beings, and not to just euthanize them, that you would put them down like an animal.
Sure.
That's just not the way we're supposed to function Islamically.
Gotcha. All right. So let's talk about today's topic, birth control. So
reproductive rights in general.
Reproductive rights in general is probably a better title. Yeah.
Because reproductive rights, it entails more than birth control. So let's get a biomedical definition of what reproductive rights is. What exactly is that?
Okay. So they'd prefer to use the term family planning because that sort of encompasses, it's sort of the same thing. Because women and couples, they want to have healthy pregnancies. They want to help plan out and space out births. They want to time them when they're ready for it, and they want to have a desired family size.
Right.
So this actually is a really common and popular thing. In the U.S., there's about 61 million women who are of reproductive age. That's between like 15 and 44, let's say.
Right.
And about 43 million of them are at risk of unwanted pregnancies. It's very easy to get that. There are people who want to get pregnant, but they can't. And there's lots of couples who they want to get pregnant when they want children, but they want to wait a little bit. And some people don't want to get pregnant ever, and want a permanent option to block that. So it sort of encompasses all these different topics. And it's also this, because this is a topical issue right now, because right now in the news, I think Planned Parenthood, which is a very large family planning clinic in the U.S. chain, they are now cutting their funding, I think, starting this week. So
Planned Parenthood is cutting their funding?
They're losing funding from the government.
Wow, that's interesting.
So
is there any particular reason why? Is that because of biomedical issues, or is that because of like political policy as per the Trump administration? Like, what exactly are the reasons
It's
why?
more for the Trump administration.
Okay.
The Trump administration is trying to pass rules against abortion specifically. Now, I know that people frequently don't realize that Planned Parenthood does all sorts of family planning. Reproductive rights is not just abortion. When people hear reproductive rights, they think automatically you're talking about abortion, right? No, it's not only that. This is a larger and broader issue.
Right. It's just that that's what they're most known for. That's what they're most famous for.
They're most famous or infamous for that. They don't just do that. Most of their money goes to giving out birth control, doing Pap tests.
Right. OBGYN issues.
OBGYN issues.
Right.
So not only known
and
for
from what I know, they also do postnatal healthcare as well, do they?
A little.
Not that much.
Not as much because, well, there are doctors who are OBGYNs who do both.
Okay.
And that's your regular doctor. I'm going to see you for prenatal care, for your follow-ups and everything.
Prenatal and postnatal.
Postnatal. So we do all that. Planned Parenthood.
Postpartum
issues, definitely.
Right.
So that's a great. It's just a big encompassing topic. Is the easy answer for this. A lot of people do use sort of birth control. About 99% of women who are between age 15 and 44 in the U.S. who have ever had sex have used some sort of birth control. Contraceptive. About 60% of women right now in that age group are currently using some sort of contraception method right now. More married women than never married women. They use birth control more.
That's actually interesting. You would think that figure would be the opposite.
Right.
That more non-married women use contraception as opposed to married women. Sure. That's very interesting. There's a lot of irony in that.
It is. It's a surprise. But if you think about it, it's because married women are more likely to be sexually active. So as a result,
obviously,
they're using more birth control methods. But married women are still using it more than people who have never been married. 93% of married women are using some sort of method. 83% of never married women are also using it. Now this is interesting because it's like for bioethical reasons. It's common among all religious denominations.
Right.
Very frequently people think that Christians don't get birth control, Christians don't do abortions. That's actually not true.
It's very not true.
About 89% of Catholic women and 90% of Protestants use some sort of method for contraception. 99% of Catholics and Protestants have used it at least once in their lives. It's a surprise.
Well, even with that, let's explore the different types of contraception, because we know that even the concept of contraception is very archaic historically.
Yeah.
Like, for example, even the Cometics, the ancient Egyptians, they actually have sculptures. If you go to museums like the Brooklyn Museum or the Metropolitan Museum, they actually have symbols of figures, of Kemetic figures that have ancient, archaic condom apparatuses on their they have like phallic symbols that represent condoms. On statues and sculptures, which indicate that they had this concept of contraception.
Sure. Well, that brings up to the next point, because there's various types of contraceptives.
Different methods, right?
Different methods. So this is a very frequent topic in doctors' offices. People come in all the time asking for advice on this. People want options to prevent a pregnancy, or sometimes the opposite. They want to get pregnant and they can't.
Well, let's start with the contraception that tends to work the least. The pull-out method. That's clearly that works the least, because realistically, pre-ejaculation can get someone pregnant.
Oh, yeah.
Realistically.
Very realistic.
Are there any stats, by the way, as to how many people become pregnant as opposed to pre-ejaculation as opposed to
Yes.
full ejaculation? There's actually stats on that?
There actually are rates about this. So it's always a question about do they work, or is it what's called perfect use? So like certain remedies work really well, but the problem is people don't use them in the real world correctly.
Right.
Like if you take birth control pills, you got to take them every single day.
Oh, right.
And people forget to. And
Right.
then all of a sudden, why are some people getting pregnant with it? That's not, well, it's because of they're not doing it correctly.
Right.
So they have like a difference between it.
Right.
Let me see if I can find that statistics for you, because there's, well, let's just talk real quick about the different types.
The different types of contraception.
So there's a couple different ways.
Right.
Prevent the sperm from getting to the egg in the first place.
Right.
That's like condoms are the big one. Some sort of barrier that stops it.
That's like the go-to.
Yeah.
The go-to contraception, right?
Other ones are there's medications that ways to prevent the ovaries from releasing eggs in the first place, so it just can't get fertilized. And that's like pills, patches, shots, even the emergency contraceptive, like morning after pill, what they call it.
Oh, like what they commonly call like the Plan B?
Plan B.
Is
yes.
Plan B and the morning after the same thing?
They are the same thing. Plan B is the brand name. Morning after pill is what the people just commonly call it.
Okay. So morning after is just like the generic name, popular culture name
Yeah.
of it.
Yeah,
Plan B is the actual. Okay.
Exactly, because it actually it's not just the morning after. You could use it 24, 48 hours up to after. It's what they call emergency contraception.
Okay.
So like after the
So
fact.
what exactly does it do? What exactly does Plan B do?
So what it does is it either blocks the ovaries from releasing an egg.
So in other words, it stops ovulation.
It stops ovulation is one option, or if they just had sex, it can stop the egg from implanting, meaning
So in other words, it prevents it from clinging to the vaginal wall.
correct.
Right.
So, and depending on who you ask, because this is another ethical topic of, is this considered prevention or is this considered an abortion? Because some people have different opinion on this
Oh,
one.
you mean relative to conception, the actual
Right.
fertilization of the egg?
Right, because in some cases
good
you can
question.
still you still can have
Conception
fertilization.
can still- right.
Conception can still happen.
Right.
So depending on who you ask, this could be considered abortion or not. And
Right.
there's other options like IUDs, something that's kept in place that blocks it from implanting.
But there have been cases of women getting pregnant with the IUD.
Yes. None of
How
those-
often does that happen?
It's very rare. It's under 1%. It's not doesn't block it completely, but it makes it harder for the egg to find a spot to implant on.
Now, if I'm not mistaken, I remember, like, back in the days, they used to use like diaphragms or the sponges.
Yes.
Were those the prelude to the IUD? Because it seemed like they have the same purpose.
They came around the same time, and they both were around, like, talking the 60s and 70s. They were both very
The
popular. for
IUDs
that.
are that old?
IUDs, they've gone through different various types. IUDs are actually very surprisingly almost ancient, because the Bedouin Arabs thousands of years ago discovered if you put rocks into a camel, it prevents them getting pregnant. And so they would try this. And
Wait,
so
they would try this with humans?
well, not rocks.
Oh.
But the idea, the concept
That's
was
interesting.
some sort of thing to block it would work, and this worked. So IUDs have been around for a while, although they weren't really like medically.
I'm glad you
effective.
mentioned that. The Comedics, the ancient Egyptians, they would actually use wheat as like a pregnancy test.
Yes.
They would have women urinate on wheat, and based on the color change, they were able to determine whether the woman was pregnant or not.
And it actually worked really well. It was
fairly
like
accurate.
70% accurate, which is surprising.
Relative to that time in history,
Relative to
that's
that time.
phenomenal.
They're trying to figure out, is it certain hormones that can cause the barley to grow?
I mean, well, yeah, right. Obviously, those things, they change the chemical composition of the
kind of
of the
amazing,
wheat.
isn't it?
A lot is amazing. Yeah, yeah.
Because it's not really like, if it worked like that, we could do it today, but we still use sonograms because it's just
Because the
not
technology
as-
is just available.
It's just technology is available.
Right.
It's amazing because you don't think it would work like that. Babies have the same kind of hormones in the
That
urine.
thing basically hasn't changed. Exactly. It's just amazing that those archaic methods actually worked in the way
yeah.
they did. Right.
So, just to give a quick medical disclaimer here, your choice of birth control depends on a bunch of different factors: your health, how frequently you're sexually active, how many partners do you have, do you want to have children in the future? Because there are
Your
permanent
personal
ones.
choice, just in general. Yeah.
So this is something that you and your doctor should make a plan together about, because there are permanent methods like sterilization, like vasectomies, or getting tubal ligation, getting your tubes tied,
Right.
which prevents permanent pregnancy.
Right.
They are reversible, but it's very difficult and it doesn't always work.
Well, how damaging to the human health in general would the reverse be? Are there any stats on that specifically?
I'm not really sure. The thing is since it's a surgery, any surgery has some risks of a complication,
of course.
infections and stuff like that.
Right.
So
And also the reverse, obviously.
and yes, and if the reverse, so if you're a woman, the risks are a little higher because it's a bigger procedure, and you also have a risk of what they
And
call
because of her reproductive parts are more internal as opposed to a man.
correct, and you can also risk something called ectopic pregnancy, where the egg gets lodged in the tube, and that could be dangerous. That people do die from that. So reversing it.
You mean because of like fallopian like bursting or something?
Right. So if you remember, the egg comes out of the ovary, goes down the fallopian tube into the uterus.
Right.
If you're getting sterilization, it's meaning they're cutting those tubes so the egg just cannot go.
Right.
You can reverse it, although it's difficult and it doesn't always work.
Right.
And there's a risk of, if you do reverse it, it could get stuck in the fallopian tube, and then it grows there. It's not supposed to grow. It's supposed to grow in the uterus.
Right.
If you have it's called an ectopic pregnancy, and people do die from those.
Wow.
So that's an actual emergency.
How often is that, by the way?
They're not that common. I'd say maybe less than 1%, but
It's still a reality.
it's still a reality. If someone comes in saying I'm bleeding, or I'm getting abdominal pain,
That's one of the first things you would have
first
to
thing we
check.
check. Oh, it's not very common, but if you get it, it's dangerous.
Right.
So we check
You said
everyone
it's
right away.
life-threatening. It's life
It's life threatening.
Right.
Definitely. So so reproductive rights. I guess we talk now. We have different types, right? So we're talking about preventing it and then managing a pregnancy. Now there are also ways. We're going to talk about this a little later, but there are ways to, if you're pregnant, to stop a pregnancy, which is called aborting a pregnancy.
Right.
And that's become a very, I'd say, dicey political issue. I'd say if America ever had a civil war again, it'd be over that more
Right.
than anything
Definitely.
else.
I mean, especially for us as Muslims,
Yeah.
this is particularly controversial. Not exclusive to Muslims.
Yeah.
But particular to Muslims is a very controversial
Sure.
issue.
So starting from the top, what does Islam say about reproductive rights?
Okay, as a general principle, obviously, the maqsad, the objective
Yeah.
of the Sharia of Islamic law is to promote life, to preserve life.
Okay.
So, as a general principle, it's neutral ground in terms of, because we know there's text Islamically in terms of like the most archaic method of like the pulling out method.
Right.
So that's proof that type of contraceptive existed relative to the revelation of the Quran. So no Muslim can ever say that contraceptives holistically are mahrum, Islamically prohibited. However, these things have to be, these things cannot be done in the dark.
Yes.
These things cannot be done outside of the knowledge of husband and wife, because Islamically, the rights that a man has over a wife are equal to the rights that a wife has over a husband. For example,
I see.
if a man says that he wants to get a vasectomy, Islamically, it would be wrong for him to do this without consulting his wife, because
see.
his wife has sexual rights over him, and his wife has reproductive rights over him. Let's say, for example, if a husband doesn't want children or doesn't want any more children, he would be obligated Islamically to consult his wife about something like this.
I see.
And she would have a right to say, okay, let's see, or no, this is not happening. And then vice versa. If a wife wants to get, let's say like a hysterectomy or tubes tied or what have
Right.
you, she would be Islamically obligated to consult her husband. Why? Because her husband has sexual rights over her, and he has reproductive rights over her, and he has the right to say either to be for it or to be against it.
I see.
And then also we have to take into consideration that, again, going back to the objective of Sharia, the objective of Islamic law is to preserve life, and not just preserve life, but to promote life. Obviously, these extreme measures of contraception, which are classically more permanent than slipping on a condom or putting in an IUD, these are more permanent forms of contraception. These fall under the category of either what is known as makruh, detested or hated or discouraged, or also, in a certain context, would be validly classified as mahrum, Islamically prohibited, because you're preventing the potential for life.
I see.
And again, going back to the Islamic principle is that we don't own ourselves. Everything about our personage, even in terms of our souls, is the property of Allah. And because it's the property of Allah, Allah has the right to tell us what to do with our personage. Allah has the right to tell us how to live, where to live, who to marry, who not to marry, those type of things. And in terms of reproductive rights, Allah has the exclusive right to tell us how to reproduce, how not to reproduce, what methods to use, what methods not to use. All these type of things are included in Revelation. So as a Muslim, we tote a very fine line
Yes.
in terms of contraception, which types of contraception are Islamically acceptable to use versus which type of contraception is prohibited to use. Now, just as a general principle, holistically, something like a vasectomy would be Islamically prohibited, holistically,
Okay.
because of the nature of what its purpose is, what its maslaha is, what its purpose is. Its maslaha, its purpose is to prevent a man from spreading his seed.
Right.
Right. Likewise, for a woman to get her tubes tied, principally Islamically, this would be prohibited because it would prevent her from being fertilized.
I see.
Just as a general principle. Now, that would be relative, and again, this would be a discussion that a wife would have to have with her husband, and a husband would have to have with his wife. Now, also, as a general Islamic principle, this is actually from a narration of Muhammad, peace be upon him, recorded in the collections of At-Tirmidhi and Abi Dawood, in which Muhammad, peace be upon him, he said, pertaining to the advice of husbands to their wives, he said, be careful. He said, I urge you to deal with your wives gently or cautiously, because they're like your prisoners, or like they're like your property. So Islamically, a woman is classified as the property of her husband. So if a woman wants to have, let's say for example, she wants to have an abortion, or if she wants to have her tubes tied, or those type of things, she would literally have to Islamically get the advice and approval from her husband, because he's Islamically responsible for her, because Allah says in chapter 4 verse 34, "Ar-rijalu qawwamuna 'ala an-nisa," men are responsible for women. And because of that, everything that occurs, even in terms of the anatomy of the woman, it is the responsibility of the husband to ensure her safety, medical safety, spiritual safety, psycho-emotional safety, what have you. So on that basis, anything that pertains to a female spouse, the male spouse has an authority. Now, we're not talking about on-the-spot life or death necessities. We're not talking about that. But clearly, something like a hysterectomy may not necessarily be a life or death necessity. It could be, but not necessarily.
I see.
An abortion could be a life or death necessity, but not holistically, not inherently.
Okay.
Maybe tubes tying, maybe based on some particular medical circumstance, may be a life or death medical necessity, but not exclusively. So we're not including in this context, in this discussion, we're not including the exceptions, the valid life or death necessary factors, which no one needs permission from anyone, because that pertains to your direct health, that pertains to the preservation of your life. When it comes to the preservation of your life, you don't need anyone's approval or permission to preserve your health or preserve your life.
Right.
But outside of those parameters, in terms of Islam, in terms of husband and wife, again, the man has an obligation to consult his wife if he wants something like a vasectomy. Okay. And likewise, a woman will have to seek the approval of her husband if she wants something like to get a tubes tied or to get an abortion, things like that.
So you're saying there's a bit of a shared decision making on these if you're a couple?
Yeah, most definitely. In terms of husband and wife, most definitely.
Okay.
Or even in terms of, let's say, for example, a woman, if she's not married or if she's divorced and she's living with her family, whoever is her closest Muslim male relative, she would have to consult them about things like this. Because if a woman is not married, she's the responsibility of her father or her brother or her grandfather or any male relative who's Muslim.
I see.
And based on that, they would have to make a decision as to whether they approve this or not. This is from Islam. Now, obviously, being as though we live in a pro-feminism, pro-women's liberation context, this is very sour for people. This is a very sour pill for people to swallow.
Yeah, I can imagine not everyone
course.
likes those sorts of, because you mentioned that the husband has some sexual rights and the wife has some sexual rights as well.
Definitely, right.
So, and I was still trying to find the statistics here because I actually had a listing of different birth control rates, and I can't find it right now. It'll come back to me later.
Is there anything that you can like modestly remember offhand?
Yeah, actually. So, like the birth control pill, right? What they call the pill.
Right.
So this kind of pill. Those have about a failure rate of about 7%. So 93% of the time it works.
That's pretty high.
But 7% of the time, people
That
still
still
get pregnant.
matters. That
It
still
still
matters,
matters, yeah. And
Even if it's 1%, like you mentioned, the other
Yeah.
factor is 1%. It still matters. As
Yeah.
long as it's on the grid, it matters.
well, if you use it perfectly, there's a 1% chance.
But that 1% chance still matters.
It still matters.
Yeah.
But the thing is, people don't use it perfectly. The birth control pill, 7%, you're going to
You
take
know
it
why?
every
Because
single
we're
day.
imperfect as human beings.
We're imperfect. Because you got to take the birth control pill every day. Even if you're not having sex, you got to take it every day. And around the same time every day, every morning. Like I can't, I'll skip, I'll take it at dinner time. You got to take it around 24 hours each
Yeah,
one.
because literally the point of it is to deregulate your ovulation cycle.
Right. And so people, in the real world, people are not doing it correctly. So 7% of the time people get pregnant anyway.
Right.
So we tell people, I know there's a 1% on the box, but that's if you take it perfectly.
Right.
So I tell people, look at other things. The birth control depot shots, that is a one shot every 10 or 12 weeks. You can come and just get a shot and go.
Right.
It's a slow release injection.
Right.
That has a perfect use rate, 1% also. But people miss their appointments.
Right.
They come 13 weeks instead of 12 weeks.
Right.
They
So in terms of the shots,
Yeah.
does that shot release some type of hormones, or does it prevent the human female body from producing necessary hormones to commit
that's a
ovulation?
So that's a good question. It releases a hormone that kind of prevents ovulation. It kind of tells the body you're already pregnant.
Okay.
So it tells the body don't release any
So
more eggs.
anatomically, it deceives the body.
It deceives the body. But like I said, 1%. It's usually 1% if you use it perfectly. It's 1% pregnancy risk. But people skip it. They take other antibiotics.
Obviously, because of natural human error.
Yeah. So that's like a 4% in the real world failure rate.
Okay.
Now, like I said, condoms, for example, 98% of the time with perfect use, if you're using it perfectly correctly and don't make anything correctly, 98% of the time it works. However, typically 13% of the time it doesn't work.
Right. And I'm glad you mentioned that. Even in terms of the use of condoms,
Yeah.
this is also something that spouses would have to consult with one another. Because again, you may have a male spouse who wants children
Yeah.
and a female spouse who doesn't want to have children, either right now or ever.
Right.
Right? So that conversation has to be had, because both husband and wife have sexual rights over each other.
Yeah.
So if the husband wants to use a condom and the wife doesn't, that's the situation.
Yeah.
Because what if the wife
Definitely.
wants to get pregnant, and vice versa? What if the husband wants to have a child?
Sure.
Right? Or what if, let's say, for example, if a woman feels that she's not ready to be a mother, or she just doesn't want to have children at all, and she wants to use like feminine condoms, or she
Yeah.
wants you to use masculine condoms.
Yeah.
That's something that has to be conferred and confirmed between the spouses.
Yeah, yeah.
Because they both have sexual rights over each other, and they both have reproductive rights over each other.
Right. There are to look at other religions, for example. Catholic Church, which is the largest population of Christians, they believe that anything that prevents fertilization,
for life.
potential life is sinful and not allowed.
Right.
They the only thing they do allow is what they call the calendar method, which is when you figure out when your cycle is.
Oh, okay.
And that's you can have sex during this one time of the month when you're not going to get pregnant. It's
So
very-
realistically, most people don't have that type of discipline to really keep going to the calendar.
Yes.
I mean, even though we have Google Calendar,
Yeah.
most people are not going to use Google Calendar.
You can
for
only
things
do it
like
a couple
that.
days a month.
Right.
And people still get pregnant anyway during
Right.
that time period.
But that would be
So-
very frustrating as well, to have like that type of like kind of like Spartan sexual lifestyle. Like nobody wants to live like that.
Nobody
Who
wants
to
to.
live like that?
So
Yeah.
actually, I checked. Only 2% of women, Catholic women, actually do that. And
I'm honestly surprised that there's any that actually keep that type of regimen.
it's a surprise, isn't it? And if the people who go to church every month, multiple times a month, and the person who don't go to church, same, they use 2%.
Oh, that's interesting.
So, well, that just comes to a bigger point because Islamically, so we're talking about because the way anything that prevents fertilization is considered a sin
In Catholicism.
in Catholicism,
Right.
and they believe that life begins at conception.
Right.
So once there's fertilization, that's alive, and anything that stops it is a sin.
Right.
And that's what the Catholic belief is. Protestants are a little
More lenient.
more lenient, and they have difference of opinion, so it's a little
Right.
more spaced out.
Definitely.
So we talked about this contraception in itself.
And a holistic context. So again, Islamically, you cannot say that contraception in a holistic context is mahrum, Islamically prohibited.
Right.
Because we have text which allow specific types of contraception.
Sure. So now you mentioned before about vasectomies and getting your tubes tied.
Right.
Is permanent options like that holistically, is permanent options allowed?
Those type of permanent options are mahrum. They're not mahlul. They're not Islamically allowable. They're mahrum. They're Islamically prohibited unless there's a proven, valid life or death medical necessity for that to occur.
Sure. And that's a good point, because there are women who are what they call high risk pregnancies. If you have certain anatomical issues or because of age,
or just general genetic factors.
We don't recommend getting pregnant for certain women.
Right.
It's as simple as that.
Right.
If you have there's a disease where your bones break very, very easily, we tell people do not get pregnant.
Yeah,
You're very
those
risky.
genetic factors.
Yeah.
Right.
If you're diabetic, we tell people you don't recommend getting pregnant if you can avoid it. Otherwise, if you can, try to lose the weight. If you're type 2 diabetic, try to to bring it down because it's safer.
For some women, they develop diabetic pregnancies, right?
Yes.
Yeah.
And
that's very dangerous for the child and the mother.
It is. And if you're already pregnant and if you're a diabetic and you become pregnant, that's actually what they call high risk pregnancy.
Right.
That's actually kind of worrisome to me. You need a lot of monitoring, and there's a lot of risks of problems.
Right.
If you're under, we recommend not getting pregnant too young, because that has those are high risk pregnancies.
Oh yeah, definitely. Right.
Because of the size of the woman, the baby can get stuck.
Right.
This
is a higher risk of maybe perhaps miscarriage, or also death while giving birth.
Those are riskier pregnancies. So there's a better range. We tell people also, if you're after, I think, age 40 maybe, after a certain age, you become higher. The higher the age, the higher the risk of the pregnancy. Right. It's also higher risk of Down syndrome and other issues.
Right.
So all pregnancies are not risk-free. It just, we're trying to find ways to minimize the risk. We say, also, we tell people don't get pregnant right after your first one. I mean, space them out a little bit.
I mean, what time frame would you give? Like a 15-month time frame, 24-month time frame? Like medically, what type of medical suggestion would you give?
It's sort of a holistic sort of thing.
Yeah, just in general. Would it be like no pregnancy within within less than 2 years or something like that?
We tell people at least try to space out at least 12 months apart.
At least 12 months.
We try. I mean, 18 months might be better.
Okay.
Because if you're still breastfeeding, then you're pregnant again.
It throws your chemistry off.
It throws things off.
Right.
It's not as easy.
Right.
Now, some people, they get pregnant back to back. And we call that, there's actually a name in New York called Irish twins, where your siblings are like 9 months apart. Well, you call them Irish twins because the parents got multiple pregnancies back to back.
Yeah, somebody was getting busy, clearly.
No offense to anyone Irish.
No offense to anyone who has children back to back like that.
So I'm sure we're going to get some follow-up question.
Oh, yeah, for sure.
Gareth, you're the chaplain. Why is it I can spay animals, but humans and vasectomies are different?
Again, the same thing that you mentioned about the euthanasia of animals, because animals don't have souls. And because animals don't have souls, the regulation in terms of treatment to them is just at a different scale.
I see.
It's just at a different level.
Right.
The human being, first of all of the makhluk, all of the creation of Allah deserve respect.
Yeah.
But the respect is at different levels. The human being deserves the maximum amount of respect among the creation of Allah.
Sure.
Because of the station that Allah has placed the human being above other creation.
Right.
Because Allah has placed the human being as a status as the supreme being, meaning the most supreme of the beings that Allah allowed to exist.
Right.
Right.
Okay. So I guess this is the next question, because there are a lot of people who really do not favor contraceptive, either talking about it, education on it.
People just don't want to talk about it.
People don't want to talk about it.
It's necessary to talk about it.
Absolutely. People are uncomfortable about it, first of all. And second, there was a really common belief that if you teach reproductive rights in school or birth control, contraceptive ideas,
promote sexual promiscuity.
Exactly.
And things like, I have to modestly disagree with that, because we had sex ed in school.
You did.
And sex ed, things like sex ed are important. If anything, not having sex ed would have the reverse effect.
Yeah.
Because anyone knows who has basic intelligence, the worst people to learn about sex from are your peers.
Yes.
Because at those ages, we've all been those ages before. Yeah. We have a completely jaded and pathological view of what sex and sexuality is, based on external influences, especially in the age of pornography, digital age, things like that.
Right.
We either don't know what we're doing, we don't care about not knowing what we're doing. We just have this very immature, barbaric, savage view of what sexuality and sex is, and we just want to release hormones and stress and tension. and that's really what our worldview of what sexuality is.
This has always been an issue,
historically, among human beings. So the worst people to learn about sexuality from are from your peers. But when you remove a mature academic facilitation of cultivating people concerning sexual education, then you're left with many of the results that we have.
I see.
Now, I don't agree with imposing certain things or certain sexual postures upon people. Obviously, us being Muslim first, but to give a primer in school, I think that's something necessary.
Yes. So in the 80s, President Reagan was against teaching it in schools. He felt that if you have the knowledge, you'll use it. But in reality, we've done multiple studies and follow-ups, and we actually see that schools that only teach abstinence or don't even teach any sort of sexual education at all, they have a very high teen pregnancy rate.
You know why? Because there's such a great void that is being filled by toxic pathological elements.
Sure.
And like you said, the stats prove it.
The stats prove it.
Yeah.
The US
it's just like you mentioned about Ronald Reagan. Nancy Reagan said, just say no. And every crackhead in America was still saying yes. So obviously that didn't work very well.
Right. So if you have the knowledge, you'll use it. I mean, I took algebra. I don't do math.
Right.
But you're right, because what happens is if you don't get it from school, you're getting it from your peers.
Exactly.
And then you just wind up, the people find teen pregnancy. The U.S. and the UK have the highest teen pregnancy of all developed countries.
Probably in human history.
We're really up there. We're up there compared to all these other places.
And the irony is that these people are not even married. So the whole concept of marriage is a whole different conversation because people, they discourage marriage at younger ages, but yet teen pregnancy or sex at younger ages is something that's accepted and tolerated even more so in our society.
Absolutely.
They even have reality shows about teen pregnancy. It's basically like glorifying teen pregnancy.
Oh, yeah. It used to be people, the good old days, back in black and white TV, you never saw people having sex outside of marriage.
Not just that, you never saw people on TV sleeping on the same bed.
Right.
Very rarely you saw shows like that.
And back then, even back in that time, 3 out of 10 people had sex outside of marriage. Now,
it's still extremely high.
And now it was 70% or higher. Now, the last I heard,
it's about 8 out of every 10.
It's about 8 out of every 10 now, and it's unfortunate. So, actually, first I want to do some follow up here because we're getting some questions in our chat right here.
All right, that's great.
So let's see. First one here on the top.
Okay.
Is if animals don't have souls, why can't we hang pictures of them in our home?
That's a good question. That goes into the Islamic definition of what imagery is. Mm-hmm. The Islamic definition of imagery is anything that Allah either directly or indirectly created. Mm-hmm. Also, it entails anything that is mobile or animated that has life. So the Islamic definition of life, particularly, not exclusively, but particularly in terms of the definition based on the Arabic language, the definition of life Islamically is the ability to breathe. So if you're a created thing that has a breathing apparatus and you're animated and you're mobile, you are considered a haywan, a living thing.
Right.
Because oftentimes the word haywan is translated as animal, and that's not correct.
Right.
So because the definition of haywan literally means a living thing. It means a thing that breathes, a thing that performs gas exchange, a mobile, animated, created thing that performs gas exchange.
Absolutely.
And also in terms of legislatively, Islamically, anything that is created that has eyes is considered imagery. So if the eyes are not visible, then it doesn't have imagery.
So back to I think the idea is that anything living, you don't want images of it in your home because...
well, I mean, there's direct revelation for it. Muhammad, peace be upon him, he said that the angels of mercy do not enter homes where there are dog-like animals, nor figurines of imagery.
Right. Because this is how idolatry had started from basic...
Right, the people of Noah. Right. Yeah. So that by definition is one of the seeds that with how a shirk association
Yes.
ascribing false qualities to Allah not based upon revelation.
Right.
This is one of the methods, the imagery of like idol making, things
Sure.
like that. So this is why holistically imagery is prohibited Islamically, because it has theological origins.
So whether they have souls or not is not really relevant.
It's not relevant in terms of that regard.
In terms of that specific issue,
Right.
Because things don't have souls. People worship them anyway.
Exactly.
And so this is a separate sort of idea.
Right.
And the idea that things do whether they have souls or not, it's sort of like, with artificial intelligence, I can make a computer program very complex and answer questions and do some logic. And animals,
Alexa is a perfect example.
Alexa is intelligent but doesn't have a soul.
Right. So therefore, it's not a living thing. Not just that it doesn't have a soul. The Alexa apparatus doesn't breathe.
Right.
It's animated, but it's not something that Allah created directly. Allah created it through the intellect of the human being, and that's why Allah says in the Quran that He created ships that are used to float upon the waters. Allah didn't personally create shipping vessels,
Right.
but He created them indirectly via the intellect of the human being.
I see. Okay. So you go here.
Is
So
there any other questions?
not just yet, but
Okay.
we're gonna see more as they come
Yeah,
as they come through.
of course, definitely.
So this brings another question. So if using contraceptives, if they led to promiscuity, I'm a doctor. I give it to patients.
Right.
Can I give contraceptives to unmarried patients if I know they're not married?
That's a good question. Principally, obviously being Muslim first, the default answer would obviously be no. But then you would have to you would have to take into consideration whether or not they would be able to file a lawsuit against you for not providing that service. Those ramifications come in. So I don't know that end. So for you as a doctor, let's say for example, if you were like an OBGYN doctor or just internal medicine
Well,
practitioner.
I'll answer the secular part in a second.
Right.
But there's a question of, like, for the same reason, like, if someone has STDs and they're not married, can I treat them?
I mean, obviously you would have to treat them.
Well,
if they have the
from
actual-
an Islamic perspective, what I'm saying is, am I getting a share of their bad deeds if I give them?
Because you're still providing them a medical service.
Right.
Because just like Allah says in the Quran, Allah says in chapter 5, verse 8, and never let your hatred against any people prevent you from behaving justly.
Right.
Just because someone leads a sexually deviant lifestyle, that doesn't mean that if they're ill, that we don't try to give them the help that they need.
Sure.
It's just like if a person is afflicted with, like you said, an STE. Does that mean that we leave them to their devices and let them die? No.
Right.
They're still a human being.
Sure.
They still have an entitlement to human dignity regardless of the sins that they committed. So for us to not give them medical treatment, Islamically, that would be a sin.
Right.
And because we're not held accountable for their sinning, we're held accountable for ours. So if we're Muslim, we have to be Muslim first. And if we're in the medical field, we're still obligated Islamically to give them necessary medical treatment if they require it. So in other words, if a person comes and they acquire an STD because of the lifestyle that they live, we as Muslims can't say, "Oh, you're a sinner, I can't treat you." Islamically, that's wrong.
Right. So, because that's more of an episode for topic for a future episode. I didn't want to talk about that more because there's topics of pre-exposure prophylaxis, all those prep ads you see on the subway. But I guess the question is, so how is this different than if someone I know is not married and they want birth control? Would it be a bigger sin to get them pregnant or get them an STD? So I'm saying, well, it's the lesser haram here to give.
That, and again, scholars obviously they would differ in terms of something like that.
Sure.
I'm going to say myself, if you have an out to not provide them with the contraception, to try to free yourself, just like what we discussed about the DWD, death with dignity, right? About the assistant physician suicide, right? So obviously, realistically, if they want to die, they're going to go to someone else, right? But for us as Muslims, we have to try to kind of like decrease the Islamic collateral damage on our end.
Sure.
You know what I'm saying? So if you have a medical professional out to avoid giving someone contraceptives, if you know for a fact that they're not married, then try your best to do so. But realistically, what's the probability of you actually even knowing that this person is not married?
I don't usually ask. No, you're supposed to ask, like, are you with one person, with multiple people?
Okay.
Because there's questions you need to know, because those are important things I need to know.
Right.
I try to put a judgmental face on, because if they're not going to trust me, then they're going to lie.
Realistically, right.
And realistically, they're going to give me advice. They're going to tell me things that are
and the
going
more
to hurt
dishonest
themselves.
a person is, or the more a person lies to you, you're not able to do your job more effectively.
Right. So to answer the question about the secular thing, because, there are, this day and age, there are people who, for religious reasons, are refusing to give birth control or contraception.
Or any type of contraception.
Any type of contraception. So, for example, there are some number of Catholic pharmacists who are like, you get a prescription for birth control pills. I don't believe in that, and I don't want to fill it. And they will say, I'm sorry, I'll give it back to you. I can't give you this prescription. Go to the Rite Aid down the street. They can do it. I'm sure they can. Now, the way the current regulations are is you can say this depends on the state, but this is sort of controversial because it's still changing right now because lots of pressure on them to fill it anyway. But the more agreed upon definition is, well, if you can't do it, and that's fine, you can't do it. If you view birth control as murder, then you're not going to be forced to do this. But you have to give it to, say, go to another pharmacy. And I'm going to tell you there's a Rite Aid down the street, go to that Rite Aid. Now, there are people who say, well, if I'm telling you where to go, then I'm still an accomplice to this.
Right.
And there are people who don't want to do this either.
But then, on the flip side, you may have some Muslim scholars who would take the position that you should do it to prevent bastardization, to prevent children from being conceived out of wedlock.
Right.
So that may be an opinion that other Muslim scholars or contingencies of Muslim scholars, they may take that view as well. They may take the view that it's better to give these unmarried people contraception to avoid bastardization, to avoid people being conceived out of wedlock.
I see.
So it's like it under those circumstances, kind of like a pick your poison type of scenario.
It's a tough issue because it's a tough judgment.
It's always going to be a tough issue.
All right. So next, we have a question here. What about contraception to treat depression, acne, PMS, PMDD, endometriosis, etc.?
That's all you. That's not.
That's on me. So from an Islamic perspective, okay. So to start off here, there are people who use contraceptive pills and hormone medications, not just to prevent pregnancy.
See, honestly, I didn't know that.
So, because what happens is, for example, if you have really, really heavy periods, and they're causing lots of bleeding and pain and discomfort, people will take birth control pills to stop periods.
Right, and those things can also prevent things like endometriosis.
Hi, how you doing? So sorry to interrupt, but the building is closed now, so we're asking everybody to head out.
Oh, okay.
All right, thank you.
All right, thanks. I'll finish this question real quick.
Yeah,
so, to finish, people will take birth control medications to slow down or stop periods, or if you have really severe acne, like pimples that just do not go away with any kind of medication, some birth control medications, because they're hormone medications, can help stop
Wow,
that.
that's interesting.
And it's something called endometriosis, where just because of an anatomy issue, the lining of the uterus sometimes will implant outside the uterus, so people get like pain, and every month they get painful cramping sensation, and they're much more heavy to the point where you can't even go to work for some people.
Well, I mean, obviously, under those exigent circumstances, then Islamically you would be obligated to take whatever type of medication which would eliminate or relieve that type of
Sure, and these are not intended to prevent pregnancy.
Right.
These are intended for other reasons.
Right.
And
Well,
unfortunately,
fortunately, the permeability for the usage of the medication is for circumstances that is in the question and that you mentioned.
Absolutely.
And Islamically, it's completely allowable and is necessary if that medical condition affects you directly.
right. And this is a problem because there are, like, if you're in high school, severe acne or these sorts of conditions, you're taking birth control medication. But people will see it. Oh my God, you're taking birth control?
I mean, and that's
You
the
must be
stigma,
promiscuous.
right? But see, that's the whole judgmental thing, is that we have to allow ourselves to give each other excuses and not be judgmental.
I see.
So, but that comes with education.
Yes.
That comes with education. That comes with understanding, and also allowing people to live their own truth relative to their own conditions,
Right.
and to not be a nosy person. Just mind your business.
Sure.
If it's not directly affecting you, or if you don't have a viable solution to the issue, stay away from it and relegate it to someone who has viable solutions to the issues of the people.
Sure. So the last question I do have here is, if these more well, actually, we'll probably talk about this at the next episode because we have a whole issue. We even talk about post-fertilization, abortion
We're
issues.
definitely going to have to make this.
That's
going to
be a separate part two issue.
and we would have to get directly into the abortion issue.
We'll have to get into that another
Yeah,
time.
so let's just reserve
Because
that for next
Islam,
week.
the short answer is Islam is very more nuanced on this. This is not as easy
It's
as...
not. It's a lot more gray area.
There's a lot more gray area, but I think it's actually a more realistic take because,
Right.
not to knock Christians or Jews, but they have a very different take on when does life begin.
Right. So very quickly before we leave, Islamically, there's 3 types of abortions.
Okay.
So the first type of abortion is resulting from sexual assault, or
Okay, we're wrapping up here.
Me being able to go home is contingent upon me being able to say all spaces are clear.
Okay, no problem.
okay.
Appreciate that.
All right,
Thanks.
no problem, no problem.
All right.
Yeah,
All right. Make it fast.
yeah. So yeah, we're gonna have to wrap this up. So for next week, we're actually going to get into this other phase of the reproductive rights. So we're just going to reserve that for next week.
We'll do it for next week.
We'll do it for next week.
All right. So that
So
does
thank
it
you for joining us.
Thank you so much.
Unfortunately, we ran out of time, so
So that does it for today's episode. We'll leave it here. Thank you, Gareth.
thank you, James.
Okay, so if you have any episodes, questions about, comments about this episode, please leave a comment in our Facebook page, Sharīah's Anatomy, or tweet at us with any questions or comments. Help listeners discover the show by sharing it or tell someone about us. Thank you. We'll see you guys next week.
All right, thank you.